Hi, I'm Dr. Benedetto, and I'd like to thank you for taking the time to watch this video to learn more about your thyroid condition and how we might be able to help you without resorting to drugs or surgery. You're most likely watching this video because you or a loved one suffer from a thyroid condition, or you haven't been diagnosed but you think, I might have a thyroid condition, or you know you have a thyroid condition, you're already being treated for it, and you don't feel better, which is common. There are some 23 million Americans that are affected by thyroid disorders. That's 1 in 13 people in this country. That's a lot of people. And more than half of those people are unaware they have a thyroid problem because it frequently goes undiagnosed until it gets really bad, and then it might be too late. Now, according to the National Women's Information Center, 1 in 8 women will experience a thyroid condition in their lifetime. The reason why may surprise you, and we're going to get into a lot of things today. I'm going to be brief on this video, but we're going to talk about a lot of things that you probably didn't know about your thyroid, and a lot of things that you wish you had known, and some really cool things that we're doing though to help patients with thyroid conditions. And the problem is you've just never had it explained to you. You've never had anyone sit down and talk to you about these problems. And the reason for that is because most doctors are only vaguely familiar with thyroid disorders and how the thyroid works in general. Let me start just briefly by telling you a little something about me. I am a chiropractor. I practice in Bethlehem, Pennsylvania, and have so since 2003, treating patients with all kinds of chronic conditions. And why am I, a chiropractor, talking about how to manage your thyroid condition? And really what I've come to realize over the years is how poorly diagnosed and how poorly managed thyroid conditions in this country are. And I've also noticed a rather disturbing trend in the current treatment approach to the thyroid, which we're going to get to in a minute. But how did I get started treating thyroid conditions? Well, luckily for me, I found a doctor out in California. His name is Dr. Karazian, and he's the author of this book right here. Why do I still have thyroid symptoms when my lab tests are normal? Dr. Karazian. If you have not read this book, you need to get it. If you have read this book, read it again. Very powerful stuff, and talks about cutting-edge treatment for thyroid problems. A lot of fibromyalgia patients have thyroid problems. We'll get to that. For thyroid problems, hypothyroidism, the whole gamut. So I've trained using Dr. Karazian's methods, and that's how we treat our patients. So if you don't have a copy of this book, pick it up. It'll be a good eye-opener for you. Now, let's take a few minutes and just learn about how the thyroid works. Okay, real brief. In healthy people, the thyroid makes just the right amounts of 2 types of hormones, T4 and T3. Okay, these hormones have very important actions throughout the body. Most importantly is they regulate most of our metabolism, okay, affecting how many calories we burn, how warm or cold you feel, how much you weigh, just our general sense of well-being. So really, in short, the thyroid runs your metabolism. It's the gas pedal of your body. It's how our metabolism runs. Now, thyroid hormones also have a direct effect on most organs, including the heart, which is a big one, which beats faster or harder under the influence of thyroid hormones. This is why heart problems can also a lot of times accompany thyroid problems, especially in women. But T3, so we have 2 types, T4 and T3. T3 is the most biologically active. That's the one that our body can use more readily. And the thing is most of what our thyroid makes, our thyroid produces T3 and T4, and about 80% of what our thyroid makes is actually T4, which is the inactive form. So it needs to be converted to T3. Now this usually happens in the body's peripheral tissues. So the thyroid gland kicks out T4, that circulates through the blood, and when it gets to the body's cells and organs, it's converted into T3 that those cells can use for energy. Okay, so T4 is just a precursor to T3. Now, a lot of times we find with patients that a big problem you can have with a thyroid disorder is that you may actually have trouble converting T3 into T4. So your body has trouble doing that. Now I ask you, have you been checked for this? Most of the time it's no. So we're going to get to how we check for these things and what we do with patients, but this can create a deficiency in T3. So your thyroid's working fine, it's making the proper amount of thyroid hormones, but it's not being converted properly. So you develop symptoms. You develop symptoms you develop hypothyroid symptoms, low thyroid symptoms in the body. Now, one of the most controversial aspects of managing thyroid conditions is the use of synthetic hormones, things like Thyroid and levothyroxine, all those that are out there. And the problem is that those medications are only T4. So if you have difficulty converting T4 to T3, and again, Thyroid is a synthetic form of T4, this medication is probably not going to work for you. You have enough T4, the problem is it's not changing to T3. So these are all things we need to look at when we're evaluating patients, and we'll get into that shortly. Before we go any further, let's cover the three main problems that you can get with your thyroid, the three types of thyroid conditions. And those are hypothyroid, so an underactive thyroid, hyperthyroid, overactive thyroid, or Graves' disease, also known as Graves' disease, and a condition called Hashimoto's thyroiditis. That's an autoimmune thyroid. Now, what happens if you have a hypothyroid condition? What are the symptoms that you experience? And these will sound familiar to some of you, not to everyone, but these will sound very familiar. Things like feeling really fatigued, tired, sluggish, cold feet or hands, require excessive amounts of sleep in order to function, weight gain or difficulty losing weight, bowel movements, difficult bowel movements, depression, morning headaches, all these kinds of stuff, thinning hair, your hair falling out, real dry skin, fingernails, mental sluggishness. These are all symptoms of hypo or underfunctioning thyroid. And so hypothyroidism is a condition where the body just doesn't have enough thyroid hormone, the thyroid's not making enough, or can't properly utilize the hormones that it does make. So the main purpose of the thyroid is to run the metabolism of the body. So it's pretty logical that people that have these symptoms, they're going to have problems that are associated with slow metabolism. And again, millions of Americans have this condition. It often goes undetected in the early stages. And most of the time, even if patients are being treated, they're being given hormones, they're being told that, well, your test values are normal, the medication is working, yet you still have symptoms, you still have the same problems, or you're getting worse. So there's a reason for this, and the reason for it, and Dr. Karazian talks about it in his book, is there are 6 main patterns of thyroid dysfunction. There's basically 6 patterns that we see of a thyroid breaking down. And only one of these patterns can be helped with a thyroid replacement or T4 replacement. So odds are, if you have one of the other types, all the medication in the world is not going to help. Now, what if you have hyperthyroidism or an overactive thyroid or Graves' disease? Heart palpitations, inward trembling, increased pulse rate, even at rest, nervous, emotional, you have insomnia or you sweat at night, you have difficulty gaining weight, the opposite of hypothyroid. So again, that's an overproduction of thyroid hormones. And it's a little less common than hypothyroid, but it can actually lead to a slowing down of the thyroid. So it's usually easier to treat, but it can lead to a more severe form of thyroid problem. Now, number 3, which we're going to talk a lot about, the third type of thyroid problem you can get is an autoimmune condition of the thyroid called Hashimoto's thyroiditis. Now, what is happening is your immune system is attacking your thyroid gland. It's usually attacking other tissues too, but it's attacking your thyroid gland. This is an autoimmune disorder. This is not a thyroid problem. It ends up being a thyroid problem, but the main cause is an autoimmune condition. Now, Hashimoto's disease accounts for 90% of hypothyroid cases in this country. 90%. So odds are, if you've already been diagnosed or you have a thyroid problem, or you have a hypothyroid problem, 90% of the time you're going to have an autoimmune problem. And a lot of times with these patients, the medication doesn't help because it doesn't address the immune system, which is what's attacking the thyroid. So there's a good chance you may have this. But have you been tested for it? Probably not. It's not a routine test that doctors do, and it's obviously important to know. It's diagnosed by checking antibodies. Your immune system makes antibodies against your thyroid and against thyroid hormones. And against different maybe foods that you might be sensitive. We're going to get to that. But we can test those very simply, very easily. Do most doctors do it? No. Now, Hashimoto's patients, if you have an autoimmune thyroid, you will experience symptoms of both hypothyroidism and hyperthyroidism. So you can have both, meaning that you may be hot one day, you may be cold the next day. You may be sluggish one day, your heart may be racing the next. Just all the symptoms that we mentioned before. You could have a mixture of both. And again, since your thyroid controls your metabolism, it affects all the systems in your body. So if you have a thyroid problem, you're most likely going to have maybe a digestive problem, or a liver problem, or problems with your hormones, or sex hormones, or your heart. This is exactly why we need thyroid hormones to be at their optimal level, to be working properly in the body in order for us to function. Now, back to the disturbing trend that I discussed earlier, observing how thyroid conditions in this country are treated. And that trend is that most thyroid patients are treated the same. I don't know about you, but that bothers me because no two people react the same to anything. A medication or any kind of treatment, especially when we're talking about endocrine problems. Yet all thyroid patients, if your thyroid is low, you're treated the exact same way as someone else who has the same problem. And your cause may be different. So why are all thyroid sufferers treated the same? The problem is most doctors just aren't thorough enough. And that's a big part of what we do here in our office is to take a patient and finally figure this out. Because up until this point, by the time patients get to us, they just haven't been thoroughly evaluated. No one has taken the time to look for all these things to see what kind of thyroid problem they have. There are at least 10 different blood tests that need to be done just for the thyroid. Most doctors just do one or two. They do a TSH, they do a T4, and that's where they stop. If those are normal, your thyroid's normal. If they're abnormal, well, we'll try some medication, that kind of thing. But the reality is that you can help treat and manage your thyroid condition naturally, and you might not even need any medication. You might not even need the medication you're currently on. Now, let me stop right here, and don't get me wrong, I am not here to tell you to stop taking your medications. I did not prescribe those medications for you. I am not authorized to tell you to stop taking your current medications. I would never do that. That's practicing medicine without a license. Now, what we do is we work with your doctor that you may already be seeing to help you to feel better as quickly as possible so that maybe we can reduce or even eliminate the need for those medications. Now, how do we do that? Very specific blood tests that need to be run. You've probably already had a few of them, things like TSH, T3, T4 maybe. Okay. What we also need to check for are those thyroid antibodies that I talked about. Those are huge. We need to talk about reverse T3. There's a value called reverse T3. There's a total T4, a free thyroxine index, a resin T3 uptake, all different thyroid tests that we run. And that's kind of where when we evaluate patients metabolically, there are a couple of different things that we want to look at. And blood is obviously important. We do a bunch of lab tests, a bunch of blood tests with patients. And thyroid labs, a complete thyroid panel is important. We also want to look at a complete metabolic panel. So obviously your thyroid affects your metabolism, so we want to run all these blood labs to look at your metabolism. We want to run a lipid panel, so we want to look at cholesterol and everything that can go with that, LDLs and HDLs, all those kind of things. And we want to do a complete blood count too. We want to look at things like white blood cells, red blood cells, a specific breakdown of certain cells and how are they working. So that's where when we do the metabolic testing of patients, we do these blood labs. Now, we also want to see if you have an autoimmune disease. So we want to check to see, do I have this Hashimoto's thyroiditis that's attacking my thyroid gland? Because that's obviously going to mean that we have to do a different type of treatment to work with that. Thyroid hormone's not going to work in those cases, and 90% of the time it doesn't. So we need to check for these specific antibodies. Now, what we also do is we check for different types of food sensitivities, very common with patients, and the big one is gluten. You've probably heard this, it's a big buzzword nowadays, everyone's talking about gluten and celiac disease. Especially with Hashimoto's patients, most often we find a sensitivity to gluten. So we have to do testing, specific testing, to look for these food sensitivities. And I can bet you probably haven't had them done. Again, most patients that get to me have not. What we also need to check are your adrenal glands. And this is what we do when we treat patients, is we have to do all this work. We have to look for these things in order to see if we can get this fixed. So we do something called an adrenal stress index, and that looks at your adrenal glands. Those are your stress glands, and they are kind of brother and sister with the thyroid gland. So they work hand in hand with the thyroid gland. So if one goes south, the other one usually does too. So we need to look at those adrenal glands to see if they're working properly, to see if they're helping the thyroid do their job. Now, I can bet you probably haven't been tested for a lot of those things. We've got to look for those antibodies, look at those adrenals. And when we do these tests and things like hormones and all these things that we have to look for, when we do these tests, what we can do then is we can create a kind of a custom protocol based on the results to get you better. Because like we just talked about briefly, no two patients are alike. No two thyroid patients are alike, even if you have the same diagnosis. So we can't treat you alike. We need to figure out what's wrong, and we got to get to the bottom of it so that we can customize what you need done to get better. And we can quickly determine that once we do all this testing as part of our treatment. Now, let's talk briefly about what we do differently here, and we already touched on some of this just right now briefly. Why is what we do and why is what I do different from any other doctor you've seen up until now? Okay? Now, step one is we treat patients metabolically and neurologically. It's actually 2 steps, I guess. Step one, we look at patients, we evaluate their nervous system, their brain. Okay? Your brain, a specific part of your brain called the hypothalamus is what controls your pituitary gland, and your pituitary gland controls your thyroid. So it's impossible not to have a thyroid problem without a brain problem or vice versa. So what we do is we evaluate patients and we look at them neurologically, thorough neurological testing. It's all tests that we do here in our office. I'll get to that in a minute if you want to come in to have that done, but they're all tests that we do here in our office. There's no needles or anything invasive like that. It's just some functional tests that we can do, run you through to see if you have any brain problems. And then if we find some imbalances in the brain and the central nervous system, we do treatments for that. So we do things like exercise with oxygen therapy. Your brain needs 2 things in order to work properly and in order to help control your thyroid function. And it needs fuel and it needs activation. So fuel we get from oxygen and glucose. And again, we test for glucose problems on the blood testing. Oxygen, your brain needs oxygen. And as we age, we lose the ability to use the oxygen that we breathe. So we do exercise with oxygen therapy to help get fuel to the brain. And then we stimulate it. We stimulate the brain with various types of brain-based therapies that we do that may involve auditory stim or visual stim or different types of manipulations, things like that. We want to get the brain working right again so it can control the thyroid gland. And then what we want to do is we want to do thorough metabolic testing. It has to be complete. We have to do all these. We can't leave any stone unturned, so to speak. We have to look at all these things in order for you to get better. And so we need to do these blood labs. We need to do these sensitivity testing. We need to see if you have an autoimmune problem. We need to check your adrenal glands. If you have any of these things going on, it's going to be making your condition worse. And I can bet that you haven't had these tests run. Has your doctor run these tests? I doubt it. So these things must be checked thoroughly, and most patients by the time they get to me just haven't had them done, and that's why they feel the way they feel. That's why you are the way you are and have gotten to this point and get so frustrated all the time. And it feels like a nightmare sometimes. I know that you just can't wake up from. It's like, I feel like garbage, I'm getting worse, and no one can figure this out. And it's just because no one has taken the time or the effort to do this. And that's what we do here in our office. And I promise if you want to come in and have us check you and we decide to work together, this is what we do. This is what we're going to do. So we need to have all these things checked. Hormone levels, a big one too. Hormone levels are huge, especially sex hormones. So have you had all these things checked? Probably not. So what we need to do is to get to the bottom of this so that we can finally figure out what's wrong and be able to get it under control, okay? And now, a couple of questions you should be asking yourself. And I'm going to tell you in a few minutes how you can come into our office if you'd like to see if we can help you, okay? But a couple of questions you should be asking yourself right now. Okay, how do I get in to see you? And I'll get into that in a little bit. But basically, what has this condition cost me in terms of time, happiness, finances, enjoyment out of life? And we're going to touch on that a little bit. We'll do it right now. One of the main decisions as to whether or not I work with a patient or that we accept a patient for treatment is their willingness to follow our recommendations. Our treatment works very well, but patients have to keep up their end of the bargain. And sometimes that may involve doing things that you don't want to do. Like, we do sensitivity testing and you have a food sensitivity, and it may be a food that you really love. If you're not going to be willing to go through all this and do what needs to be done to get better, you could probably turn this video off right now, because you're not going to be accepted as a patient. We only work with people who are ready and willing to do what it takes to get better. And that's going to take a commitment. And when we talk about things like, well, gosh, how has this affected your life? And how has it affected your job and your relationships and your finances? And typically when I ask patients that, that'll bell will go off in their head. They'll be like, well, yeah, well, how much does your treatment cost? I mean, what kind of costs are associated with your treatment? Does insurance cover a lot of this? All those types of questions that I'm sure you have. And the question is, the answer really is, I don't know. The answer is sometimes, it depends on insurance coverage. It depends on particular insurance plans. Sometimes some of these tests are covered. A lot of times they're not. And the reality of it is when we're dealing with a chronic condition like this, is that you're probably going to have to dig into your pockets. There's probably going to be some out-of-pocket expense. And that's all comes back to, what are you willing to do to get better? And if there are those out-of-pocket expenses, are you willing to make the commitment that is needed to figure this out and to get better? But that's just the reality of it. So, and if you think about then, well, what does it cost you in terms of, being with your family and your quality of life? And where do you picture yourself in the next few years if you don't get this problem fixed? And what would that be worth to you if we could fix that and improve that condition? Just imagine how your life would be without all these horrible symptoms and this crushing fatigue and the weight gain and the lethargy and the depression. If we can get you doing those things again, and for most patients we can if they follow our recommendations, we got to do all this, but a lot of times that's a reality for patients. So if you like what you're here, it's making sense, you think it's something that you can do, you think it's something that, hey, you know what, I'd like to check this out to see if this is me and to see if I can be helped once and for all, and I can make that commitment and get better, then here's what we do in our office, and I'll invite you to, if you'd like to call. We do 2 free visits in our office. And what those visits are comprised of is this. The first visit, we have you fill out some paperwork. You get to come in and sit down with me and we can talk. We can look at previous testing if you've had it done, and we can see, okay, is this what's going on? What is going on? Do you have an autoimmune problem? What type of thyroid pattern do you have going on? We can look at these things and we can evaluate them. And we can do a consultation. I will most likely be able to, at that time, be able to tell you, okay, I think this might be something we can help you with, yes or no. Now, we don't charge for this consultation. It's free. If that's something you'd be interested in, I'll invite you to call our office. After we do that evaluation, if we think we can help, then I'll be able to sit down and evaluate your case and decide if this is a case that we can help, if you would be accepted for care in our office. And then we'll be able to lay all this out. Okay, what do we need to do for you specifically? What needs to be done to finally get to the bottom of this? And we'll come back and we'll do that on a second visit. We'll sit down, if you're a candidate, we'll go over this, and if it sounds great and you can commit and you can do everything that needs to be done, then great, we'll work together. If you can't do those things, whether it be because you don't want to or there are financial issues, which I can understand, then this treatment might not be for you. But either way, on that second visit, we'll sit down and review everything with you, your spouse, a loved one, to be able to decide if we can really tackle this thing once and for all. So I invite you to call our office if you're interested and you'd like to sit down with me and talk. Our phone number is 610-974-9911. There's also on this page, there's a place where you can leave your information if you'd like more information. You can leave your address, and we can send you more information, or you can have our office contact you if you'd like to set up a consultation, or you can just call us direct. Again, the number is 610-974-9911. Well, I appreciate the opportunity to talk with you today. I know we covered a lot in a brief period of time, but if you have any further questions, feel free to give us a call or submit your information and we'll be in touch. Have a great day.